May I come in?
Yes.
Hello.
Hi.
Hi, I'm Sarah.
Hi.
I'm a student nurse practitioner.
Hello.
Let's see. What's your name?
My name is Amy May.
Okay, Amy. I see here that you're 20 years old.
Mm-hmm.
Okay, how would you like me to address you?
You can call me Amy, it's fine.
Okay, great. Well, I would collaborate with Dr. Jones, and we work together, and I can, just like him, I can assess him, I can prescribe medicines, but we just work together nicely as a team. So, do you know much about nurse practitioners?
Yeah, a little bit.
Okay,
Mm-hmm.
well, great. Well, so tell me, what brings you here today?
Well, my throat is so sore, it's been hurting for the last 4 days.
Okay.
Mm-hmm. I've had a fever, and I'm just stuffy and runny and just don't feel well in general.
Okay, all right. Are you having pain anywhere?
Yes, in my throat. It hurts when I swallow. It's like needles poking me. And I also have a headache that just won't seem to go away.
Okay, all right. Have you tried taking anything for this?
I have. I've taken Tylenol, and that helps with the headache a little bit, but I've been having a fever too, so the headache or the Tylenol helps get rid of the fever a little bit.
Okay, how high has your fever been?
Anywhere from 99 to 101.
Okay.
Mm-hmm.
Besides the Tylenol, have you tried anything else?
I've tried some warm tea with honey, and that helps with the throat pain a little bit. But
Okay, that's a good idea to try that. How about anything that makes it worse? Any times of the day, anything you do?
Just when I swallow. When I swallow, it's just terrible. Time I eat anything that it hurts my throat to swallow any foods. Mm-hmm.
And then how about the severity of it? Can you rate this pain on a scale of 1 to 10, 10 being the worst pain of your life?
I would probably, at times, it is, an 8, and other times it's a 2.
Okay.
Mm-hmm.
All right, well, thank you for sharing that. Are there any other symptoms that you're having besides this?
My ears are a little bit tender when I swallow too.
Okay, all right.
Mm-hmm.
With that, I'm going to just ask you a couple of questions how it's affecting. What do you think, how it's affecting just what you're doing during the day? Are you able to get to work? How are you functioning?
Well, I'm not able to work right now.
Okay.
They have a policy where you can't work. I'm a CNA in a nursing home, so I can't work if I have a fever. So the fever has to be gone. So I haven't been at work for the past 4 days.
Okay, all right. How about, are you able to sleep? Are you feeling too sleepy?
I'm just tired all the time.
Okay.
I could fall asleep right now if I could.
Oh, wow.
Mm-hmm.
All right, well, have you ever felt like this before?
A couple years ago I had mono, and this kind of feels like how I felt with mono, because my neck is stiff too, and I can feel like I've got like my lymph nodes, they just seem kind of big.
Okay.
Mm-hmm.
All right, well, we'll check that out in a little bit. So what about, I'm going to ask you just going on to some medical history and such. How about any allergies to medicines?
I don't have any allergies to any medicines.
What about any foods or environmental allergies, latex,
no.
contrast dyes? Okay.
Nothing.
You mentioned the Tylenol and the tea. What about any vitamins or other home remedies or herbal remedies that you take on a daily basis or anytime?
I do take, I've taken the Tylenol every 4 hours. It's 650 milligrams. And then I also take some vitamin C as a supplement. I believe it's one of the stronger doses, 1,000 milligrams.
Okay.
I also am on birth control pills that I take for medicine. I missed it yesterday because I wasn't feeling well. It hurt to swallow, so I doubled up today on that.
Okay.
That's all the medicines.
Just know that, yes, take your medicine, but it's important that you take your birth control regularly, even
Okay.
if you're not feeling good. And that doubling up doesn't mean you're still protected. Okay, so just remember that, and to be safe and smart and use protection. The other thing I want to ask you is about your past medical history. So you mentioned you had mono a couple of years ago. What about any childhood diseases?
No, I've besides the mono, I haven't really been sick or had anything happen to me.
Okay. So no, what about hospitalizations or injuries? Have you been exposed to any recent illnesses?
Not that I can remember. No. You know what, come to think about it, one of the patients I took care of came down with strep throat. So I took care of them, so maybe that would be the only thing I can think of.
When was that?
That was about a week ago.
Okay. Okay. What about any history? Do you have any history of asthma, diabetes, high blood pressure, cancers? Okay.
No, nothing like that.
All right. Good. Thinking about your family history, what about, I'm just going to ask you some general chronic illnesses, any family history, just like your parents or your siblings, would be any diabetes, hypertension, cancers, heart diseases, any of those?
No.
Mental illnesses?
No, nothing like that.
Okay. What about yourself? And are you, did you get, have you had a pap smear? Have you ever had one of those?
Yes, I have. I go to the doctor regularly for that, and she prescribes the birth control pills, and everything's been fine.
Okay. Was your test normal?
Yes.
Okay, good. What about, what about vaccines such as your flu, your tetanus? I know I read here that you're a college student, so sometimes you have to get, up to date on those immunizations. Did you get a flu shot?
Yes, because of where I work too.
Oh, sure.
They require all of that. So.
Okay. Let me think. What other immunizations and screenings? I think those are pretty important. Any recent travel outside the country in the last 6 months?
No.
Okay. So now I like to ask about your social and personal history. It just gives me a better picture of your overall health. And so tell me about your living situation.
Well, I am single right now, but I'm still living with my boyfriend.
Okay.
Just as a place to be, we get along fine.
Okay. Good.
This is my second year at a junior college. I'm a nursing student there.
Okay.
Yeah, I go out with my friends occasionally, and we drink on the weekends, but that's about it.
Okay. Are you sexually active?
I am, and I'm on birth control for that. So.
Okay. And are you at risk for any STDs? For example, do you have more than one partner?
No, right now it's just my ex-boyfriend.
Okay. And you mentioned you're a CNA and that you work and you're at a junior college. What about some safety concerns? Do you feel safe? Does anybody harm or hurt you?
No, I feel pretty safe.
Okay. Do you wear your seatbelt when you drive or you're in a car? Okay. Great. So then, thinking about I think, that's all very good information, but now I'll just ask you some brief questions, just a review of your systems, and you tell me how you feel about these.
Okay.
So, kind of head to toe. Are you having any discharge in your eyes?
No.
Okay. Pain in your ears?
Pain in my ears when I swallow.
Okay, yep, you did mention that. Sore throat, you mentioned. Any white patches or anything discharge in your throat?
Yes, I do notice when I look in the mirror, I do have some white patches in the back of my throat.
Okay. Sinus pain, you mentioned a headache.
Yeah, just a headache.
Okay.
Nothing really with the sinuses. But it is kind of congested though.
Okay. Any mucus or runny nose or coughing up anything, any cough?
No cough, but well, no, nothing more than usual with a cough. I do smoke.
Okay.
So I've got, that smoker's cough.
Oh, okay.
But other than that, no cough. Just in my nose it runs, but it's clear.
Okay. And since you mentioned the smoking, I should also ask how much.
I smoke a half a pack, and I've been smoking for the past 3 years.
Okay. And what about, you said you drink on the weekends. How much do you think you drink on the weekends?
I'd say about 6 drinks.
What about any drugs such as marijuana, cocaine, meth, anything?
No.
Okay.
Nothing like that.
All right. Well, let's see. Moving on, you mentioned your neck, that you were having it was a little stiff and sore. What about any breathing problems?
No.
Heart problems? What about your belly? Are you having any nausea or vomiting or diarrhea?
I do feel nauseous occasionally, but I haven't thrown up and I don't have diarrhea.
Okay, good. And then your menstrual cycle, when was your last period?
It was a week ago and it was normal. Yeah, nothing unusual about that.
And so your cycle was pretty regular, is that what you're saying? And then the flow was normal for you?
Yes.
Okay, all right. Well, thank you. I think what we should do now is move on to the physical exam, unless you have any questions for me.
I don't think so.
Okay. Just wash my hands here. Alrighty, make sure my equipment's all working good. Alrighty. And with this, I'll just, let me know if you have any questions or concerns as we go along.
Okay.
But, basically, if you have any pain or anything like that, and if you forgot or to share anything with me as we go along.
Okay.
Alright. So first what I think I'll do is just kind of feel around and you tell me if you have any pain.
Okay.
Okay. Alright, so I'm just feel around. Any discomfort?
No.
Okay. And I would normally do this exam in a gown, and I would listen to your lungs and your heart with my stethoscope on your skin, but for today's exam we won't be able to.
Okay.
Okay, so I'm going to now check your eyes.
Okay.
And I would like you to look at my finger and follow it, okay? Okay, and now I'm going to look here. Alright, just stay looking at my nose. Now I'd like you to look at my finger. Now look behind me at the back wall. Look at my finger, look at the back wall. Okay, wonderful. Alright, now I think what we'll do is I'm going to take a look in your ears, and if you're tender at all, please let me know.
Okay.
Pardon me. Alright, now I'm just going to look in your nose. Okay, good. Alright, now I'm going to look in your mouth and we did do a strep test. That did come back negative.
Good.
Your ears look good. I think I'm in your nose too. Let's see. They're just a little red on the outside, but we'll go over all of that. I'm going to now listen to your lungs.
Okay.
Just a nice and easy breath in and out. Alright. Nice and easy breath in and out. Thank you. Now I'm going to listen to your heart. Pardon me. Switch it over. Okay. And now I'm just going to take a look at your neck here. Can you swallow? Okay, good. All right. Take a nice breath in and out. Okay, good. All right. I think lungs sound good. I think we should listen to your belly. And just inspect that, if you wouldn't mind laying down, laying back. Pull this out. There we go. Alright, so first I'm just going to inspect here. Alright, I'm going to listen. Any discomfort with that?
No.
Have you noticed any rashes?
No, not that I've noticed.
And have you had any weight loss?
No.
Okay.
Mm-hmm.
Any night sweats?
No.
Okay. All right, good. All right. Oh wait, can I help you sit up now? There we go. Let me put this back. Thank you. All right. So with that, I think what might be going on is you have a virus that's causing this nasty sore throat, and we could probably do some more tests to rule out that you'd make sure you don't have mono again.
Mm-hmm.
So a couple things just to kind of help you with some tips to stay healthy.
Mm-hmm.
I know with college students, your life is just all about balancing your exams, your social life, work. So just remember to try to eat a healthy diet.
Mm-hmm.
Lots of fruits and vegetables, and just a variety of food, not so much processed foods, sugary foods.
Mm-hmm.
So that's important to get a good healthy diet. And then rest. I know college students are known to not get a lot of rest, but it's really important for your health. So take a nap when you can, okay? Try to avoid any caffeinated beverages at night. And then also for your health is just to remember to, when you're drinking alcohol, just a moderate amount, because you can still have a good time, but you don't need to hurt your health, so just drink moderately and be smart. And then get good exercise, okay? And then just, get a good routine and make it fun, or ride your bike to class, walk to class, and just remember to stay connected with your friends and your family, and just try to get involved and just getting a good group of healthy friends. So, with all that being said, do you have any questions for me?
Not that I can think of.
Okay. Well, thank you so much for coming in today, and I hope you feel better.
All right, thanks.